Forensic pathology is a subspecialty of pathology that focuses on determining the cause of death by examining a corpse. The autopsy is performed by a medical examiner, usually during the investigation of criminal law cases and civil law cases in some jurisdictions. Coroners and medical examiners are also frequently asked to confirm the identity of a corpse. Also see forensic medicine. The word forensics is derived from the Latin forensis, meaning of or before the forum. Scope of forensic pathology. Forensic pathology is an application of medical jurisprudence. The forensic pathologist is a medical doctor who has completed training in anatomical pathology and who has subsequently specialized in forensic pathology. The requirements for becoming a fully qualified forensic pathologist vary from country to country. Some of the different requirements are discussed below. Performs autopsies, post-mortem examinations to determine the cause of death. The autopsy report contains an opinion about the pathologic process, injury, or disease that directly results in or initiates a series of events that lead to a person's death, such as a bullet wound to the head, exsanguination caused by a stab wound, manual or ligature strangulation, myocardial infarction resulting from coronary artery disease, etc., and the manner of death, the circumstances surrounding the cause of death, which in most jurisdictions include homicide, accidental, natural, suicide, undetermined. The autopsy also provides an opportunity for other issues raised by the death to be addressed, such as the collection of trace evidence or determining the identity of the deceased. Examines and documents wounds and injuries, both at autopsy and occasionally in a clinical setting. Collects and examines tissue specimens under the microscope in order to identify the presence or absence of natural disease and other microscopic findings such as asbestos bodies in the lungs or gunpowder particles around a gunshot wound. Collects and interprets toxicological analyses on body tissues and fluids to determine the chemical cause of accidental overdoses or deliberate poisonings. Forensic pathologists also work closely with the medico-legal authority for the area concerned with the investigation of sudden and unexpected deaths, i.e., the coroner, procurator fiscal or coroner or medical examiner, serves as an expert witness in courts of law testifying in civil or criminal law cases. In an autopsy, he/she is often assisted by an autopsy mortuary technician. Forensic physicians, sometimes referred to as forensic medical examiners or police surgeons, are medical doctors trained in the examination of, and provision of medical treatment to, living victims of assault and those individuals who find themselves in police custody. Many forensic physicians in the UK practice clinical forensic medicine part-time, whilst they also practice family medicine, or another medical specialty. In the United Kingdom, membership of the Royal College of Pathologists is not a prerequisite of appointment as a coroner's medical expert, i.e., doctors in the UK that are not forensic pathologists or pathologists are allowed to perform medico-legal autopsies, simply because of the vague wording of the Coroner's Act, which merely stipulates a suitably qualified medical practitioner, i.e., anyone on the GMC register. Investigation of death. Deaths where the known cause and those considered unnatural or investigated. In most jurisdictions this is done by a forensic pathologist, coroner, medical examiner, or hybrid medical examiner-coroner offices. Terminology is not consistent across jurisdictions. In some jurisdictions, the title of medical examiner is used by a non-physician, elected official involved in medico-legal death investigation. In others, the law requires the medical examiner to be a physician, pathologist, or forensic pathologist. Similarly, the title coroner is applied to both physicians and non-physicians. Historically, coroners were not all physicians. However, in some jurisdictions the title of coroner is exclusively used by physicians. Canadian coroners. In Canada, there is a mix of coroner and medical examiner systems, depending on the province or territory. In Ontario, coroners are licensed physicians, usually but not exclusively family physicians. In Quebec, there is a mix of medical and non-medical coroners, whereas in British Columbia, there is predominantly a non-physician coroner system. Alberta and Nova Scotia are examples of ME systems coroners and medical examiners in the United States. In the United States, a coroner is typically an elected public official in a particular geographic jurisdiction who investigates and certifies deaths. The vast majority of coroners lack a Doctor of Medicine degree, and the amount of medical training that they have received is highly variable, depending on the profession. In contrast, a medical examiner is typically a physician who holds the degree of Doctor of Medicine or Doctor of Osteopathic Medicine. Ideally, a medical examiner has completed both a pathology residency and a fellowship in forensic pathology. In some jurisdictions, a medical examiner must be both a doctor and a lawyer, with additional training in forensic pathology. History. In German-speaking Europe, lectures on forensic pathology were regularly held in Freiburg in the mid-18th century and Vienna in 1804. Scientists like August Ambroise Tardieu, Johann Ludwig Kasper and Karl Limann made great effort to develop forensic pathology into a science based on empirics. Forensic pathology was first recognized in the United States by the American Board of Pathology in 1959. In Canada, it was formally recognized in 2003, and a formal training program is currently being established under the auspices of the Royal College of Physicians and Surgeons of Canada. Education. In most English-speaking countries, forensic pathology is a subspecialty of anatomical pathology. Training requirements differ from country to country. Australia. There are currently 3 paths to qualify as a forensic pathologist in Australia. The first is to train solely in forensic pathology and pass 2 examinations for forensic pathology only. The second is to commence training in anatomical pathology, and complete an initial anatomical pathology examination, which takes a minimum of 3 years, then go on to train solely in forensic pathology and complete a forensic pathology examination, which takes a minimum of 2 years. The third is to complete a minimum 5 years training in anatomical pathology to qualify as a fellow in anatomical pathology, then complete a post-fellowship year in forensic pathology. Canada. In Canada, anatomical pathology is a 5-year residency. Residents who wish to become forensic pathologists must then complete a 1-year fellowship in forensic pathology. Forensic pathology is a subspecialty by the Royal College of Physicians and Surgeons. 2 schools that have training programs are the University of Toronto and McMaster University. India. In India, the speciality is commonly referred to as forensic medicine and toxicology or legal medicine. After completion of medical graduation, one has to complete 3 years of study and training including thesis research, which leads to award of degree of MD. The majority of the specialists are attached to the Department of Forensic Medicine and Toxicology in various medical colleges. The classification of posts includes assistant professor, associate professor and professor. The work profile of the specialists includes conducting autopsies and clinical forensic examinations. Apart from teaching the medical students, they have to regularly appear in the courts as expert witnesses. A typical department in a government institution conducts 100 to 5,000 autopsies a year depending upon the jurisdiction. Apart from this, the clinical forensic examinations constitute a major part of the work, and number of cases can run up to 10,000 a year in an average institution. The largest association of the specialty is Indian Academy of Forensic Medicine, which also publishes its quarterly Journal of Indian Academy of Forensic Medicine regularly. This association has a specialist member strength of more than 1,000. Indonesia. In Indonesia, forensic medicine, also known as legal medicine, is a 3-year specialty program that can be taken directly after completing medical school. It is separate from anatomical pathology and clinical pathology. Upon completion of the program, a forensic medicine specialist will obtain the title Specialist Forensic, or SPF. He or she may be addressed in public as Dr. Forensic. Note that there is no pre-medicine program, making the total duration of formal education for one to become a forensic specialist 8 years. Forensic medicine is also a mandatory round during medical school clerkship. Medical students assist the doctors on autopsies, and they may also be allowed to perform an autopsy under supervision, and to witness in a court. United Kingdom and the UK, anatomical pathology is a 5-year residency. Successful candidates are eligible for inclusion on the Specialist Register of the General Medical Council, having obtained membership of the Royal College of Pathologists. A specialist training post is applied for after the foundation year to enter a training program in histopathology. Imminent changes as a result of the TUC report may require 2 years or more to be fulfilled on general rotational placements before the option of histopathology arises. However, the Royal College have not yet issued their response to this matter. It is then necessary to obtain the MRC Path Part 1 examination in histopathology, after which it is then possible to apply to one of few training posts in forensic pathology in the UK. Current approved centres include Belfast, Liverpool, Leicester, Cardiff, London, Sheffield, Glasgow and Dundee. Not all the posts are currently actively training. Following 3 years training in forensic pathology and completion of the FRC Path Part 2 slanted to forensic pathology, you may then obtain circuit and work as a consultant forensic pathologist. Another option is to obtain the full FRC path in general histopathology, followed by another 18 to 24 months of training in forensic pathology, which will qualify the candidates with either the diploma of the Royal College of Pathologists in forensic pathology, or the diploma in medical jurisprudence. In England and Wales you will also need to be Home Office accredited, which will require checks of your training portfolio and completion of a security check in the expert witness training course run by the Forensic Science Service. Foreign graduates and specialists need to apply to the GMC and the RC path directly to practice forensic pathology in the United Kingdom. United States. In the United States, forensic pathologists typically complete at least 1 year of additional training after completing an anatomical pathology residency and having passed the board examination administered by the American Board of Pathology or the American Osteopathic Board of Pathology. Becoming an anatomic pathologist in the United States requires completing a residency in anatomic pathology, which is on-the-job training one must perform upon completing medical school before one may practice unsupervised. Anatomic pathology by itself is a 3-year residency. Most U.S. pathologists complete a combined residency in both anatomic and clinical pathology, which requires a total of 4 years. In the United States, all told, the education after high school is typically 13 to 15 years in duration. Generally, the biggest hurdle is gaining admission to medical school. Although the pass rate for anatomic and forensic pathology board examinations is approximately 80 to 90 and 90 to 100%, respectively, the courts do not require American Board of Pathology certification in order for a witness to be qualified as an expert in the field of forensic pathology, and there are several diploma mills that give online certificates in the field.